Randomized comparative evaluation of endoscopic submucosal dissection self-learning software in France and Japan. Introduction. Endoscopic submucosal dissection, ESD, was first introduced over a decade ago in Japan as a new method to achieve en bloc resection of superficial gastric neoplasms without any size limit. Since then, the use of ESD has evolved greatly and indications have expanded from the stomach to the esophagus and the colorectum. However, although ESD is an attractive option, the procedure is time-consuming, risky, and has a significant learning curve. For beginners, the risk of perforation can reach 20%, and it is recommended that ESD skills be learned on animal models before they are performed on human patients. The use of ex vivo organs represents a ready-to-use and inexpensive means of becoming proficient in basic ESD techniques. Pioche et al. Previously demonstrated the effectiveness of the bovine colon model, which is cheap and easy to prepare. Nevertheless, the first procedure should always be supervised by experts who can direct the learning path and explain the ESD aims and tips. Although the number of experts is relatively high in Asia and in some Western countries, many endoscopists have limited access to expert supervision. A self-training program could be helpful to disseminate this technique with safety. A self-learning software program has been developed by N. Yahagi in collaboration with Olympus, Tokyo, Japan, to assist trainees during their first steps of ESD training. The software consists of step-by-step virtual supervision for each of the procedure steps: preparation, injection, incision, dissection, end of procedure. The aim of the current prospective randomized study was to evaluate the impact of such a tool on the ESD learning curve in a bovine colon model in France and Japan, compared with a standard approach using only a procedure video. Background and study aims. Endoscopic submucosal dissection, ESD, is currently the reference method to achieve en bloc resection for large lesions. However, the technique is difficult and risky with a long learning curve. In order to reduce the morbidity, training courses that use animal models are recommended. Recently, self-learning software has been developed to assist students in their training. The aim of this study was to evaluate the impact of this tool on the ESD learning curve. Methods. A prospective, randomized, comparative study enrolled 39 students who were experienced in interventional endoscopy. Each student was randomized to one of two groups and performed 30 ESDs of 30 mm standardized lesions in a bovine colon model. The software group used the self-learning software, whereas the control group only observed an ESD procedure video. The primary outcome was the rate of successful ESD procedures, defined as complete en bloc resection without any perforation and performed in less than 75 minutes. Results. A total of 39 students performed 1,170 ESDs. Success was achieved in 404, 70.9%, in the software group, and 367, 61.2%, in the control group. Among the successful procedures, there were no significant differences between the software and control groups in terms of perforation rate and mean SD procedure duration. For the 30th procedure, the rate of complete resection was superior in the software group, 84.2%, compared with the control group. Conclusion. ESD self-learning software was effective in improving the quality of resection compared with a standard teaching method using procedure videos. This result suggests the benefit of incorporating such software into teaching programs.